Hi class, this is Miss Bacon and here's my lecture for chapter 15 all about medical documents you will find in a patient's chart. So let's begin. So this chapter introduces the role of a medical transcriptionist as a possible career for you. And just know transcription is the act of taking an audio file and turning it into a text file. So you're basically typing out what you hear. And this is something that's sort of old school that was kind of done more like in the 2000s. It's very common for doctors just to kind of like talk into a recorder. And then a transcriptionist would come and type out the operative report or something. So nowadays, the technology has become so advanced, doctors can use Dragon software where they'll just talk into a mic and what they say gets typed out on the computer screen. So it's kind of eliminated the role of the transcriptionist. So I kind of think the field is a little bit dwindling, but it's another option for you to maybe look into if you'd be interested in that, because it would be very interesting clinically. So again, when you start working in the field, you are going to be working with electronic medical records, and computers nowadays are very important. You will receive training on your EMR, and make sure that you take really good notes of your training so that you can do your job efficiently and competently. And if your EMR, sometimes you lose your internet connection. And just remember, whenever that happens, you just go back to charting on paper. And then when your internet comes back up, you will retrospectively document in the patient's chart to capture it in the EMR. So we continue on talking about the role of medical transcription, and just know you can be hired by a medical group, or maybe the medical group will outsource and pick a vendor who specializes in transcriptional services to provide that to the medical group. So it just kind of depends on where you work, how you find employment. So it can be direct or indirect. Like I said before, so nowadays we do have voice recognition software, and this is really helpful for some doctors who don't know how to type. So they like use two fingers to type, it's really bad, and they need to be able to document quickly to keep up with their patient loads. So we have Dragon software programs where it's basically a microphone that you talk into, and then you can see on the screen whatever you say gets typed out on the screen. And it's really nice and very helpful to those doctors who lack computer skills and typing skills. The other option would be having a medical transcriptionist transcribing reports for the doctor. And in the EMR, it's very important that the doctor authenticates every one of their notes. So they will electronically sign every progress note. And when we did have paper charts, they would just sign the paper note. So in the EMR, they basically just click on the little button that says sign, and that counts as their signature in the EMR. In terms of confidentiality and legal issues, we've talked about HIPAA before. Just remember, when you've got a new patient coming in, you have to make sure to get their signature, acknowledging receipt that you've given them the notice of privacy practices as a new patient. And if you are ever going to, get their medical record from another doctor or disclose their medical record to another doctor, that they always sign the release for it. And just use your common sense, always protect the patient's privacy and confidentiality. Never, a lot of people call and fish for patient information over the phone. It's ridiculous. And just don't give out patient information over the phone. Just tell them, that's not the policy of our organization. You have to send an fax request for patient information, because then it's more coming from a reputable source if they fax in a request to you. So those are just some good guidelines to follow to make sure that you are HIPAA compliant. Now, this PowerPoint, we're going to go into the different types of medical documents you'll see in a patient's chart. And it's important every day, right? You're going to get things coming in through your fax, medical documentation coming in through the mail. And you want to always, usually what we do is we print it out and we highlight the patient's name and date of birth. And it'll say on there too which doctor this communication is going to. And so you'll put it on that doctor's desk. And the doctor has the job, they have to initial and date every report. And then you will scan it to the patient's chart in the correct location so that it becomes part of their medical record. That's sort of the flow. And here are some examples of medical documents that you'll find in a patient's chart. So progress notes, right? So I work in primary care. So whenever a patient comes in, usually I'm generating a progress note. So the first time that they're a new patient, it'll be an initial progress note. If they come in subsequently, I'm just generating a progress note. I also have progress notes for like a telephone progress note, because now we're doing telehealth. And we can even do televisit progress notes through Zoom. So Zoom video conferencing, we can do that kind of progress note. And if the patient is coming in for their annual physical, it's going to be a history and physical progress note. Another thing too, we have pre-op progress notes. So there's different kinds of progress notes, which are really nice because you want to make sure to pick the correct one, because that way, if you ever have to identify it in the patient's chart, if you've created it correctly from the start, it makes it that much easier to find it quickly if you ever have to go back to it for some reason. So that's a little bit about the different types of progress notes you'll encounter. And just know, history and physical progress note, that's just an annual physical. And all progress notes, they have these elements to them. So the chief complaint, or CC abbreviation, is the reason for the office visit. So this is definitely done by the medical assistant. So when you're rooming a patient, right, you want to get the reason for their visit, obtain their vital signs, verify their allergies, their medications, their pharmacy, and prepare them for any procedures that need to be done for them by the physician. So that's sort of all the things you need to do when you're rooming a patient. Then when the doctor comes in to examine the patient, the doctor will document the history of present illness, if they do have an illness. And this is where the doctor will ask them questions about their illness and document the patient's response. The review of systems, these are the review of body systems that are affected by the illness. So let's say if someone has an upper respiratory infection, obviously the doctor is going to look in the ears, up the nose and the throat, listen to the lungs and the heart. They will review all of those body systems to fully assess the patient, and they will document their examination findings in the review of systems section. So just know the doctor is in charge of that. So next up, we kind of covered progress notes and physicals. So now outside of that, we have other kinds of reports that you're going to come across. So lots of radiology reports. So just know, whenever the doctor orders a radiology test, the radiology tech will take a picture of a part of the patient's body. And then the radiologist comes, looks at that picture, and generates a report of his interpretation of that picture. So you really get two things with a radiology test, right? You get the image of the body part, and then you get the radiologist interpretation in the form of a report. Okay, so that's a little bit about radiology. Operative reports. So whenever someone gets a surgery done, right, that will be detailed by the surgeon and sent to the primary for documentation purposes. So that's an op report. Pathology reports. So sometimes patients, they have, suspicious masses in their body that need to be removed. And that mass will be sent to a pathologist who will determine its behavior, if it's benign or malignant, and report back to the primary his findings. Oh, this mass, it's just a lipoma, nothing to worry about. Or maybe this mass, it's cancer, we need to have the patient see an oncologist, whatever the case may be. So that's a pathology report. Now, a hospital discharge summary, sometimes patients, right, they are in acute distress, they visit the ER, maybe they get admitted, maybe they just stay in the ER under observation, but once they get discharged, they are sent with the summary home, and they're always told to follow up with their primary just to make sure that they are recovering and they don't bounce back to the ER. So this summary is nice for the patient to have because it'll give them their aftercare instructions. So that's a little bit about these medical documents. Now moving on, we have here some other types of reports. Consultation letters. So if your primary sends your patient to a specialist, say they send your patient to a dermatologist, the dermatologist will send back a consultation report of the encounter and how they treated the patient. Now, an autopsy report is basically to determine the cause of death for a patient. And sometimes too, you will find correspondence regarding a patient that's mailed to you from an insurance company. So it can be a variety of things that is sent to you. You just want to give it to the doctor to review. Here's some pictures, right? So here's a picture of an EKG, a chest x-ray. Here's a colonoscopy. Here's a DEXA scan. On the left, some progress notes on the right. Here's lots of radiology reports. Well, radiology images, right? So we have MRI, CT scan. This is a PET scan up in here. And these hospital reports, you can get other types of hospital reports, like lab work, procedures done, besides the discharge summary. And again, just give it to your doctor to initial and scan it to the patient's chart in the appropriate location. So that's a little bit about that. And they end the chapter talking about medical transcription as a career. But I think, honestly, the most relevant thing about this chapter was all the different types of progress notes and consultation reports that you can find in a patient's chart, as well as all the different radiology tests, the laboratory reports, correspondence from insurance companies. And just remember, you're going to be getting, every day you have faxes coming in, mail coming in. Just always give it to the doctor to sign off on, and then scan it to the patient's chart in the appropriate correct areas so it becomes part of their permanent medical record. So thank you so much for listening, and have a good night.